This is not financial advice. I'm recording my thoughts about Clover Health. They recently reported their Q2 2022 earnings. With respect to revenue, they increased their revenue by about 105% from 412 million to about 847 million. And with respect to the number of patients, that also doubled from 128 million previous year to about 256 million. If it were any other growth stock, the stock price would have skyrocketed, but in case of Clover Health, nothing of that sort happened, right? Because the investors have given up on this company's business model because they don't believe that this company will make money anytime in future. Before I discuss more, let's look at Clover's business model. Clover is saying that they have developed a software or a platform which can benefit both patients as well as doctors. For patients, they promise that the patients will pay less premium and get a better care because the doctors will have a better idea about their health. And with respect to the doctors, they said even though the number of visits from their patients reduce, the doctors will get paid much more per visit. Since the number of visits are lower for the doctor now, they can accept more patients and make more money. So this seems like a win-win situation for the patients as well as doctors. So they're planning to implement this with their ecosystem of software, and they said that they could make money out of this by benefiting both patients as well as doctors. At the moment, it seems like that software is not working properly, and quarter after quarter they are posting more and more loss. The most important metric to track their success is the medical cost ratio. It's a ratio of the amount of money that they pay in claims to the amount of money they collect in premiums. A healthy medical cost ratio for any company with large number of patients is about 85%, and small or little number of patients is about 80%. With respect to Clover, they need to maintain 80% medical cost ratio to sustain their business. We do know that Clover has two revenue streams, insurance and non-insurance, and they reported insurance MCR at about 92.1%, and for the non-insurance, it is terrible. It's about 106.1%. It's definitely an improvement from the previous year's performance, but they are nowhere near that 80% figure to make this business sustainable. In 2021, they said the reason for their high medical cost ratio is COVID, because a lot of seniors got affected with COVID and Clover had to pay a lot of money in terms of claims for them. But this year, they cannot use the same argument, right? Because the number of people who got affected with COVID is significantly lower now. So their argument is not going to work at the moment. In addition, there is no evidence that in the coming quarters they will keep on posting lesser and lesser medical cost ratio to reach this 80%. They have been really inconsistent with this medical cost ratio because in one quarter they post something less and in the next quarter they post something more. So at the moment I feel like this business model is not working, and I personally don't choose to wait for them to execute because I feel like the whole business model is not sustainable with their software. Personally, I feel like they have gotten enough time to prove their business model and they have not succeeded. So at the moment, if I have money in this stock, I would just sell out and then put that money to work in a different stock.